So the question we are supposed to answer is discussing 3 to 5 evaluation questions that you're supposed to ask an athlete who comes in with a foot, ankle, knee, or hip injury, and that's basically just any of the questions following HOPS, which is like history and observation, a plan, and just like any special like visits or things that they need to do. I wrote them down, so like evaluation questions that they can ask, like a mechanism question would be like what position was your body in, and that can be for any like leg, ankle, foot, or knee injury. Specifically for like the knee, like did your knee collapse? Could you move your knee, leg, or ankle? Was there any immediate swelling? Is also another good question. You can also ask like the previous like history questions, like if you've ever had any injuries like this before, or if you've ever hurt this type of like knee, leg, or hip before. And then it also says to talk about like potential resources for an athlete, such as a professional to send them towards. The ones I could really think of was like a physical therapist, obviously after they're injured and they have their injury assessed, and just for like rehabilitation, they can go to a physical therapist. Just like on site, I know athletic trainers do things, but you can send them to sports medicine doctors, or like for hip and like leg injuries, you can send them to a chiropractor.